Good night, all those in TV and YouTube land. Welcome back to this week's episodes of HealthWise. On behalf of the St. Kitts Nevis Medical and Dental Association, I am your host, Dr. Monique Lescott, in collaboration with the ZIZ team. For those who have been with us, welcome back. Who has never been with us before, welcome. We have a very interesting show in store for you guys tonight. I have two of my lovely colleagues here to discuss with you tonight the JNF and outpatient and ER department, the structure and the run-ins. On my immediate left, I have Nurse Nydia White. She's the OPD manager and admissions and discharge planner. Yes, and to my right, I have Mr. Delbert Wilkes. He's the emergency medical technician at JNF. Welcome, you guys, and thanks for coming. So, it's going to be a very interesting show. Like I told you guys, we're going to be discussing just the general structure of our primary health care and what it entails, what the general public needs to know, what you can expect. It's like a kind of PSA, so to speak, because it's been my observation that there are many persons who don't quite understand structurally how the system works. So I have my colleagues here to give me a hand in explaining to you guys, so that whenever any one of you listeners or persons looking on can come and take full advantage of our health system, but in the right way, because I know that some of us have some misconceptions and some misunderstandings. So we're going to open the floor with Mr. Delbert Wilkes. Can you tell us briefly what your role is at the hospital?
Good night, Reginald, to all of you. Again, my name is Delbert Wilkes. I'm an emergency medical technician. For the past 20 years, I functioned as an EMT. Recently, I've been performing some other duties around the hospital in relation to the broker within the Central Medical Stores division. But tonight, I've chosen to accompany this panel to discuss the provisions made by the government of St. Kitts and Nevis in relation to provide the provision of health care and the layout of the structure of the emergency room and the hospital
in general. Yeah.
In general.
Thank you. And on my immediate left, I have Nurse White. I'll allow you to introduce yourself, and you can explain briefly what your roles are as well at JNF.
Good night again. Yes, my name is Lydia White. I'm the admission and discharge planner for the General Hospital and also the manager of outpatients department. My role at the hospital is to provide great care to our clients. And being an outpatient nurse manager, we're responsible for all the clinics that takes place at the hospital.
Okay, awesome. Well, that is a very huge shoe to fill. I can imagine it's a lot of negotiating, a lot of back and forth and communicating, and to make sure all persons are attended to as much as we possibly can. So I guess we can take a quick commercial break, and we'll be right back.
I hope they have it, you know. I hope they have it.
How can I help you today?
Yes, I've been searching for this medication everywhere and no one seems to have it. Please tell me that you do.
You've come to the right place. We have just what you need. And even if we're out of stock of the item, as soon as it comes in, we will notify you.
Thank you.
Bestway Pharmacy, always taking care of all your pharmaceutical needs.
Welcome back to you again, viewers. For our returning audience, welcome back, and who has never been to our show before, our platform, welcome. So we're going to start with Mr. Wilkes. And one thing I don't think persons are very clear on, we're going to have a very clear discussion on what constitutes an emergency. When does a person begin to think about coming to the emergency, because it's very important that persons know when and how to utilize the department and not just come to the emergency room for ailments or situations that are not categorized as an emergency. So we'll dive into that. You tell us, what is an emergency?
All right. So let's try it. What we must bring to the general public is how they utilize the services, because the government of St. Kitts and Nevis has made provisions for a robust primary healthcare system and affordable healthcare for all, which means that everyone have access to a somewhat 11 health centers on the island of St. Kitts.
11.
And
Wow.
free hospitals.
Okay.
But as in every situation, there's a criteria in which people will meet to meet the needs.
Mm-hmm.
For too often, people has been utilizing the services, and I don't think that we have a clear-cut definition on what the roles of the department are, the function within the department based on the general public consensus.
Yes.
To start with, as an emergency medical technician, I understand what it is to deal with emergency situations. And you've been taught that an emergency means anything that would warrant urgent medical attention. Too often people come to the ER, the emergency room, where we call in our institution the accident and emergency department, and to utilize the services. But the name clearly defines what the department functions should be. Accident and emergencies. Emergencies is defined, like I earlier said, anything that warrants urgent medical attention.
Yes.
It is therefore not a first come, first serve basis.
Yes, and some people...
We have to understand that people come to the department, and we're going to be mindful that we're going to be recognizant of their people's emotions when they come into getting care, because not everybody is medically inclined, and they probably does not understand to the full extent what should be construed as an emergency, because for them it's an emergency.
Yes.
But we know good, and they come to the department and they have to wait for extended period of times, because too often it's a crowd. Their requirements does not meet some of the levels of the criteria within the ER setting. And I'll define that for you, because they have some color codes which are red, yellow, and green. Red is most critically injured patient, and they're the ones that we tend to want to give urgent medical care for. Then you have your yellow, which is less critical, and they're going to need some in-hospital treatment. Then there's the green, you know, the walk-ins, the ambulatory ones. They can be delayed, but we will from time to time reassess to make sure that no one falls in or out of any one of the criteria, so as to meet their needs.
Yes.
You will see too often people come to the department and they complain about how long they've been there and who came before and after. But there's a triage system.
Yes.
And we're doing that so that we can meet the priority needs of the person that best warrants the earliest attention.
And I think they forget that the ambulance, even sometimes while something or persons are being triaged out front, the ambulance is also busy bringing persons that are also very critical
Point taken.
to the back. So then it creates a dynamic where the staff has to split their attention, and that's a very difficult tightrope wire to walk.
That if one come by means of ambulances, because one can't really help themselves.
Exactly, so
and
then that would take precedence.
The doctor's urgent attention.
Yes. I think the average wait in the ER overseas is like something like 3 hours, average, even overseas.
Yes, like 4 hours more.
Right.
Well, I've heard visitors to the department, Americans who complain, while locals complain about the delayed time that they have to wait in the department.
Very quick to them.
Sometimes these people just come in and say, it's the most quickest
quick
that they have gotten, because they have to wait sometimes
the whole
camp
day
in the department.
overseas, yeah.
Yeah, so we have that, but we have to bring to the attention of the public what is it that constitutes the ER. Because like I said, the government make provision for primary care in our communities in means of health centers, and some of the things that people who want to come to the department for would be best suited be seen in the clinics.
The clinics.
At the clinics.
So that is
true.
It will reduce the lengthy wait of times and the delays.
Yes.
So then the clinics should be your first line of defense, because as you brought to my attention, this was off camera, that sometimes persons would have had an existing ailment and it's already chronic. Sometimes they had this ailment for like 3-4 months.
It's true. That's true.
They decided, well, I'm going to come to the ER today, when that should have been a health center issue.
Yeah,
Right,
sure.
right.
I mean, let's just reference. Someone has a cold or cough and presents to the ER, quote, your emergency room, and says, Doc, I've had a cold for the last 2 weeks.
That's supposed to be.
weeks.
That's definitely
But-
health center.
But she comes to the ER, the emergency room, and then somebody walks in with some medical conditions, asthmatic, and then they complain that they're sitting down there and nobody paying them attention because they come before so and so, and so gone and left them. But you got to understand that the ER is to serve the urgent needs, the medical emergencies. As it clearly defines accident and emergencies. Now, what are accidents? I mean, we have motor vehicle accidents, we have job-related incidents or accidents,
Oh yes, and those injuries are sometimes
falling from
critical.
heights on the job. A construction workers on our rooftop and he falls. We have electrocutions and all those things that warrants. I mean, walking down the road and falling on your own velocity or weight is totally different from falling from a height exceeding 10 feet or more.
That is true.
I mean, one can picture the extent of the injuries based on force, weight, and velocity of the impact.
We're going to stick a thumbnail on that. We're going to take a quick commercial break, and we're going to elaborate some more because there's some other stuff that I don't think the public is really privy to when it comes to dealing with the ER and how the system works. We'll be right back.
It's time that we realize that we must work together to thrive. The world as we know it, the sky and below it. Could I never have more wonder? Yeah, with life and all you see and the climate's changing. But hope is remaining. And we can't ignore the future. It depends on you and me. One chance, all that we got. One voice, together we start. Take care, the world where we live permite a todos vivir. Tomamos la oportunidad para importar la humanidad. And I must leave no one behind because we are one climate, one Caribbean. One climate, one Caribbean.
And welcome back again for all of you, all of those who have been here before, welcome back, and who has never been here to our platform, welcome. So we're going to continue our discussion, our very interesting discussion, and we're going to elaborate on what we were discussing before the commercial break.
Also, we get back to this discussion, and look at this. Look at some things that happens here. We have a government that tried to put in place mechanisms for people to get the best health care
For as reasonable as possible.
at an affordable cost. You can't beat that anywhere else. We have health centers, so they are open Monday through Friday at 8
to
4. Then there's the ER. We're not saying that one can't come to the ER if one doesn't have what we will term medically as an emergency, but if you have a concern and it's after the hours of the regular working day that you will be seen, and everybody will be seen. But the thing is that one must understand that one can't really take advantage, because at the same time their actions will be compromising those persons who are in dire need of that emergency care. And in terms of talking about emergency care, let's relate to the ambulance service, the ambulance services. Everyone wants, when they have what they call their emergencies, to get attention and the response of the emergency vehicles. But at the same time, if you call the ambulance for something that does not warrant by the procedural codes, and then somebody has an dire emergencies, the ambulance could be tied up responding to non-emergent care, while someone who has a dire need for the ambulance is not there. So we must all be mindful that
yes, we have to share the resources, and it has to be managed properly.
We have to be responsible citizens in regards to the government provision of the health service.
Yeah, that's true.
Make it so that every one of us can have the best care that we are looking for.
Because that's what we're really trying to aim for. I guess in the long run, we're looking to have universal health care where we have as many persons as much as possible to have coverage and access to health care. That's a privilege, you know. I don't think persons realize how much of a privilege that is.
Really, that's so true.
It's much very so. Then I also wanted to touch on the fact that I've heard some persons of the public mention that certain things at the health facilities should be free, which they are. On the health center level, a lot of the services are free, but when it comes to the hospital, some of the clinics and even some of the emergency care sometimes can incur a cost, but I don't think some persons know this.
Yes, there is. Definitely don't. Some people do not
understand.
Yes, they do not understand.
Because
there is a fee. In regards to, I'll step back to my brother what he was speaking about in reference to the emergency. Speaking about the health center, we were separating about the blood pressures. At mornings, sometimes very early in the mornings, maybe around 7, 8 o'clock, there will be a flock of persons who will come in to want just the pressure to be checked. You know, in the area we're trying to
in the ER, so that can be done. That can be done in the.
That is part of the health center.
That's a health center thing,
right? So we're trying to divert them. We want people to understand this is not an emergency, and what it does, as you said, is takes away the essence of really serving those who actually need that emergency care. Right. So I would like that to go out foremost to the public.
Let me make an objection here. At the health centers, there are doctors at the health centers, right?
Yes.
Because the public consensus of the public is that they come to the ER because there's no doctors at the health centers.
Okay. There's a doctor, and they actually have the regime plan at the health centers as well.
And they have days for
monthly
special
clinics.
care?
Yes, monthly clinics are done there where they actually see the doctor, the medical doctors. And if there's any need to be referred or to be admitted, then those persons will be admitted to the JNF hospital.
And they do fall under your hands because you're the admissions and discharge planner, coordinator.
Yes.
So in other words, if everybody do what is expected, we'll have a smooth flowing system.
Definitely.
From primary to tertiary to discharge, admission and discharge.
Admission and
the cycles can be
straight
repeated.
To discharge.
I see.
Right. So we're talking about fees.
Yeah, I know that's a ticklish one, and sometimes persons can dance around the issue. But when it comes to the issue of paying monies to the clinics or even sometimes to the emergency room, I get a bit of pushback sometimes from the general public. Sometimes even if they get a prescription from the emergency room doctor, there's a pharmacy outside, and the charge for the medication is usually very minimum. Minimum. It's not like full price, and sometimes even stuff like that would get a negative feedback from the public. Like, we can't have every single thing free. Like, the hospital does need some money. Like, we need to run it efficiently.
It's a flat, easy fee of $10.
But so you're telling me that the doctor writes a prescription for 5 medications, and all that 12, person pays is $10,
and I've gotten lamb-based before, and people have told me why this so and so and so and so and so and so, and I was so confused. I said it's only $10 because just across the waters to Nevis, things are run very, very differently.
Oh no, that's
even though the persons, we have a lot of persons here that has insurance, medical insurance. Sometimes persons will come up and they do not have the cash. They will ask, can I use my insurance? He said, sure, just go to the cashier, let them know your NCI, Sagico, they'll deal with the situation. And we are not that hard in JNF Hospital. Our government have set it so safe for persons that no one is denied. So definitely, even if they do not have the cash or they're not required to have insurance, they actually give them a bill. They just go politely, they say what it is, and they'll give them a bill.
So that's it. So, I mean, we do need money at the hospital. Like, I can't say that enough.
Well, for our clinics,
wherever in the world you go, healthcare has always been a
Expensive.
government Achilles.
Yeah.
It's not easiest thing or easiest ministry in any government anywhere in the world.
But do we have to pay for the ambulance service here?
In St. Kitts, no.
No.
Do you know what a privilege that is?
Sure.
And I would not even begin to mention which island country you have to pay what, $75?
Oh, just
to call the ambulance?
Just borrow our waters, our sister isle.
We do have a lot of
there's a
conflicts
fee
with that
attached to
here.
the ambulance.
We do have a lot
service.
of conflicts with that because we have ambulance service, as my co-worker here knows. Being an admission and discharge planner as well. They coordinate persons to be taken from the hospital to the home. And persons who are actually hospitalized is the same ambulance that uses them to take them to the outside care that they need, like having echoes and x-rays
Also, that
off
can run
the
up
compound.
quite a bill if they have to
So that's
utilize.
the inter-facility
Right.
transfers and transports.
So,
Okay, but the ambulance, now you know how much availability of the resources, if there were some guidelines as to stipulation of cost,
Yes.
it will reduce significantly the abuse of the service.
and I believe if monetary, were actually taken for it, we could have looked at it a long way in the future, in the sense where that money they probably would have raised is to actually help them get another vehicle
And for
and
maintenance.
transport.
I just
take
tell that
them.
healthcare is not an easy thing, and it's every government
Yes.
anywhere in the world Achilles. Every government will fight with the healthcare program.
Well, at
But
the
our
outpatient-
government is doing their best to make sure that
That
every
everyone-
citizen has
Access.
access to healthcare.
no one is denied.
And I think that's something that we overlook so much, because sometimes the way how I see the public pushback, I mean, I understand we're not perfect, we're not the
No.
best, there are many things that are lacking, but we do try, especially trying to work with persons that might not have monetary means, but they need care, they need looking after, they need attention. We try, but then as soon as we make a little misstep, boy, the public is ready for us.
Yeah. I don't think the public really knows how much work is being done on the inside
It's true.
to reach to people, actually those who cannot afford
It's true.
their health care. Reference to being the admission and discharge planner in seeking, because this doesn't end just in JNF, we have to go to social services,
Yes.
in regards to help persons who cannot afford to even pay their bills or even leave to go out of the hospital to have an extra test being done for them.
Wow.
And these are things that the government lists with all the other branches on the outside, so we can provide the best care possible to our people. This
So then how
nation.
does it go? Sometimes they will go to the health center. I'm trying to get a flow chart going here from between the ER department to the OPD,
All right.
and to establish how sometimes a patient might need follow-up, the referral. How does it work? Just shine a light for everybody, if any one of you guys can explain, like how does it work. We're going to take commercial break in a bit, but I'm just getting you guys thinking. I wanted
Right.
to know, like, I got into injury, I come to the emergency, I'm treated here, and I guess the emergency room doctor would see me, get me my prescription, and then the follow-up would be
Adult patients.
outpatient. So
Yes.
then what I would allow you to explain is the maybe list of treatments and follow-up clinics and patient care, and maybe give an example of maybe one or two of the clinics that might have a small fee, minimum fee.
Yes.
Okay, so we'll take a quick commercial break. We'll take a quick commercial break, and when we come back, we'll elaborate and have some more discussion. And I'm sure you viewers out there can't wait to hear about the small fee, just a small fee. I know you can't wait to invest in your health.
Cheers to the city. Cheers to the city. the city.
Yeah, man. Another day in the books. Well, hello there. Ooh, she pretty from head to toe, and are you ready to go? Wait there. Whew. Can't afford to slip up. Not even in my dreams.
And welcome back, viewers. I know you guys couldn't wait for the commercial break to be over for us to touch on this very interesting topic and to elaborate some more. So without any further setbacks or delays, we're going to get right back into the discussion. So right now we're going to be speaking about this cycle of admission.
Yes.
So
Yes.
I'll let you get
All right.
into that.
Cycle of admission. Patient can be referred for admission from the health center level, from their personal physicians, family physicians, and from, of course, from the ER department.
No patients.
So
No
the
patients.
referral would
And the
usually
outpatient,
be
and the outpatient
Patients
department.
in the
Now,
form of a
difference,
letter.
The ER, the emergency room, and the outpatient department.
Okay. Yes, that's exactly how it works. But from on the outside, from the health center for admissions, there must be referrals. Even if they're actually being referred to outpatients department for the clinic, there must be a referral. No one is to be reached into the clinic without a referral. We cannot accept persons to the outpatients department without a referral.
Okay.
So the referrals may be coming from the emergency room and also from the health centers and even from the private doctors.
I was about to ask if you get private
Private, yes.
private referrals.
Yes, private referrals as well.
Okay, so
And
so the OPD also has specific clinics on specific days. Maybe
Yes.
you can explain that one.
for outpatients, persons do not see the work that outpatients do every day. It's a place of feet. It's a lot of walking. It's a hustle place. We carry on 24 clinics. We'll say 26,
Wow.
but we look at 24. It doesn't look like that. But that's how much clinics we run.
Is that on
in
a weekly basis?
Weekly basis.
Wow.
We have from Monday to Saturday.
Wow.
And
And some of the clinics
it's,
then, for the public.
we will just go a few.
Just
you
name
know.
a few.
We have the orthopedic clinic, that's the bone. Anyone having any fracture, anything to do with their bones. We have the vascular, that's one new on our scale, the vascular surgeon. We have the uro, and we have the neurologist as well. And we have the dietitian at our patients. We have the antenatals, and we have the gynaes that comes there. And we also have the surgeons, and we have the medical doctors coming there as well.
The specialists,
The
yes.
specialists, these are specialists. And we have the ear, nose, and throat specialists. We have the endo. And now we also have the pediatrician works there as well. We actually carry the neonatal clinic as well, but because of the load that is going on, it used to be taking place at the health center, so now they refer it back to the health center. So it used to be on Mondays, so the health center works along with the doctors for the babies, so they have the specific days now.
So the
The
neonatal
neonatal is now at the health center.
Still at the health centers.
Yes,
We'll
so
turn back to the health centers.
pediatrician children clinic still is held at our area. And we have the EKGs, everybody knows about that. Anything referred from the clinics comes straight to us. When we have persons being discharged from the ward and they don't have a private doctor, they are altered at our way as well, our patients.
Okay.
So government provides physicians for those
follow-up.
that cannot-
All. And they are specialized doctors. Sorry, all specialists works in outpatients department. All specialists.
Let me get something clear and let's return back to the health center level. You said that there's all those clinics at the outpatient department at the hospital,
Outpatients.
but those are strictly referrals.
All referrals.
Referrals.
Yes.
Okay. At the health center level, I'm living in St. Paul's. There are health centers in St. Paul's. St. Paul's?
Yes.
St. Paul's. So I want to utilize the service of my health center in my district.
Yes.
But I'm hearing about all these
Specialists
at the hospital. Do doctors come to the districts, the clinics?
No. They're set at the outpatients department. We have trained medical doctors.
So who sees
at the health
who at the health center level?
We have specialists at the health center level too. And we
I just want to make that clear,
medical doctors
because there are doctors within the health center
who are specialized as
who are
well
specialized and
in the
can
areas.
see your needs.
Right.
And they will make the referrals
to the
for
area.
patients if they think that you require a specialist.
That's
intervention.
exactly what it does. Yes.
Okay.
And our fee, the government make a small fee to outpatients department, but it's required. They have required age, 62 and over, 17 and under is exempted. It's no charge for them. They can come.
So we are quite confident now that established criteria that children and the
17
elderly,
and under,
senior citizens,
62, yes,
are government responsibilities, and so therefore they are exempted from fees at the government institutions.
Right.
Okay.
And that fee is just $20. Those who had age to pay is just $20.
$20. You see, I told you guys it was a
and then you get
minimum
a
fee.
list for 20 prescriptions for
Your medication,
$10.
you get your blood taken off, your EKGs, all your examination, whatever the doctor required for you to be done at the outpatients department during that clinic, your dressings, wound care, sutures to be removed, everything is being done there.
You know, that's like so perfect. Like, I couldn't believe one time I really got lambasted for this $10 fee at the pharmacy. Like, I really thought it was a lot of money, but it was $10. And I thought that was the least I've ever seen.
Quite interesting. Speaking about fees, so let's recheck a little bit here and let's go back to the ER, the emergency room.
The emergency room, in some places also incur a cost as well to see an emergency doctor.
Now what unfortunately for us, they don't have to pay to see the doctor in our ER.
Okay.
There might be a little cost for treatment at the department. Not insignificant.
How much is it, do you think? $20
I
as
don't
well?
do that
I'm going to find out. We're going to stick a
don't
thumbnail
know.
on that, and we're going to go into our...
But I know, because some people come and they expect, and then the nurse might give them a note and tell them, hey, go to the cashier.
Cashiers would know the
cashier
price.
would know the
Because the nurse
price,
will give the
right?
prices now. Let's get it straight.
I have one of them on my WhatsApp, I'll ask, but we're going to stick a thumbnail into that. We're going to go into our spotlight, and this week's spotlight will be Nurse Gilma Richardson of the ICU department at JNF. I've had the pleasure of working with Miss Gilma, and it was a real pleasure. Gilma is a very nice and capable and competent nurse, and it is my pleasure to give her a feature and a shout out and a thank you and appreciation.
Gilma Richardson is a registered nurse midwife who has been in the healthcare industry for 19 years. She has a Bachelor of Science in Nursing and a certificate in midwifery. She also has a certified clinical instructor and nurse preceptorship certificate. She is presently the nurse manager of the intensive care unit at the JNF Hospital. Her job includes constant and ongoing monitoring and assessment of a patient's condition, using specialized equipment, interpreting and evaluating diagnostic test results. She believes that every life matters, and so she keeps abreast with the changes in healthcare management and ensures that every day she handles her job with careful attention. Richardson has a passion to pursue studies in health administration, and with the knowledge and experience in nursing, she can provide valuable insight and a unique perspective in healthcare management and administration by improving efficiency, quality of care, financial performance, and develop new policies.
It's time that we realize that we must work together to thrive. The world as we know it, the sky and below it. Could I never have more wonder? Yeah, with life and all you see and the climate's changing.
But hope is remaining.
And we can't ignore the future. It depends on you and me. One chance, all that we got. One voice, together we stand. Take care, the world where we live. Permite a todos vivir. Tomamos la oportunidad para importar la humanidad. And I must leave no one behind because we are one climate, one Caribbean. One climate, one Caribbean.
And welcome back, viewers. I know you guys have been enjoying this program so far. I know you guys have been soaking up all of the new information. Some maybe not so new, maybe other persons might have already have an idea of what we have been speaking about here already. So we're going to elaborate some more on the function of the ER and what to expect, and again, just small minimal fees that might come with treatment and trying to get you the best care at the hospital.
Well, best care is something that the hospital motto speaks to. Striving for excellence. And it's making sure that we give, you know, there's a saying that goes, a nation's wealth is a nation's health.
Yeah.
And the governments of the day, past and present, have put things in place where every citizen has access to health care. We can't beat that. And while we understand the need for health care, we are hoping that the public will also understand that they too has a responsibility to make sure that they continue to receive the best care by contributing whatever they can and little they can to the upkeep. Government, because the government is me and you know.
Yeah.
So when it costs us, we say the government, but it is me and you, taxpayers' money. And we are investing. So if everybody keep in mind that they are contributing and to continue this trend, not just for now, but for always. And to get the best care, we know that we have to put some effort into, respecting the policies and that have been put in place, because government has been quite considerate in the cost
I think so.
for healthcare.
It's
healthcare is not
highly
cheap.
subsidized. Very
Government
highly subsidized.
subsidize this.
Sometimes I don't think the public understands how much they would have had to pay out of pocket if it wasn't for the subsidiaries of the government. And we try to consider each person, because in your line of work you were mentioning that you even would handle social service aspects of it. You can elaborate on this some more if you like, because I don't think some persons understand that. For instance, I've had patients on the ward where they don't have family members. It's time for them to be discharged. They don't have anyone to care for them, which if someone is recovering from a serious illness, even though they're discharged, it does not mean that they're 100% to take care of themselves fully right after a discharge. We would prefer, if we're discharging you into a house where we're sure that you would be at least not alone. You're having some assistance, someone is looking after you, in at least even if it's to look in on you to make sure you're still alive type of thing. And I've known persons to need welfare assistance to get them into the Cardian home, because to release them or to discharge them back into their community, there's no one to take any sort of care of them.
White, this is your forte, Ms. White, as the discharge coordinator.
So you can explain, elaborate a bit about this, how challenging it is, because I know the Cardian home is also limited with their bedding.
Right. as we can speak, at this very moment, Carden Home is already filled. It is
How
filled.
many beds does the Carden Home have, you know, offhand?
I will tell you, Carden Home had, in its time, a very small number, but because of what is going on, they have made room in a sense we are not adding to the building, but finding space to accommodate our people. Right now, Carden Home will have probably about to 80 right there.
And
Right,
with
so
full
we've been
capacity.
Full to capacity, full.
And
so
is
we're
the
still
Carden
making
Home,
room.
that's a facility that is also free?
It is free.
It's a government-run
The
institution.
government runs it. But in the sense where, I would say, being the admission and discharge plan, we're seeing a lot of this occurring in our society, where we only see the problems when it comes to the hospital. That is where we're seeing it. When it comes to the hospital, that's where we recognize what is going on. We're having persons who are unable to care for themselves, persons exactly who lives alone, doesn't have any backup. And we do have persons that live with families, but everybody is so busy at work and cannot provide the care at home. And some people, finances are very small. We cannot even take them to a private home or even somewhere temporary at day. So it leaves a lot of thinking and arrangement to see how can we go about in changing things in society to help persons in these situations.
Because then what I see happening sometimes in situations like that, the person has no choice but to remain at
Very
the
long.
hospital.
Sometimes
And so then that also puts a strain on the hospital resources, because then the nurses now would have more on their plate than they otherwise would have if this person was able to be
Definitely.
adequately placed.
Right. So see, imagine this, that you have persons, the hospital, the wards are already filled. But some of the persons who are in there are actually discharges. Right? So then the nurses still have to give care
To the
to
discharges.
the discharges.
So what happens when we have case that warrants admission?
Well, we have a case that warrants admission. There is always, I would say, God always involves. He finds room. He gets it done for us. And, you know, we are not a society that pushes our people aside. We give the best and we do the best that we can do as
From the
nurses
hospital
and healthcare.
perspective, I can
Yes.
I can
We
probably
can do
testify to
that.
that. But
In
in
a
a
sense.
a general consensus,
But we have-
what I've realized
in-
often too much is that a lot of our senior citizens
Yes,
are
are
being
being
shunned by
neglected.
family members.
Yes, are being
because I'm
neglected.
sure you can attest to some situations where
It's really, really
people are lodged at the hospital, they get visitors, but on discharge, they tell you that they have nowhere to
Nobody
go.
comes
Nobody
to collect
comes.
them.
How do you deal with
Well,
these situations?
Over the time in working in such a field like that, it humbles me in a sense. But how I deal with it is that it makes me go all the way to help people. I go all the way to help people. I involve social services, I involve the society, the area that they live, you know, in helping getting the persons out at times and then having neighbors to help people. Sometimes I have to go to that point in having neighbors to help persons and attaching them to social services, where so we have social services worker, persons that goes to on these fields and provide care like bathing, feeding and so forth, and giving medication. In reference to the hospital, if it's really full to capacity, sometimes we have people running over in emergency room ready to be admitted, but we don't have the space. So we're trying to let the public to know that it is very vitally important for us and for all of us to see what is going on, so we can see, you know, be each other's keeper in the sense where be providing and helpful and think about, you know, your families in the sense with this, so we can make things easier for all of us.
So then in the event that on admission day, their loved ones don't come to collect them, how do we go about escalating that matter? Do we go and knock on their doors and say, hey, you have loved ones
No, we
today?
won't do it like that. We'll call them. I'll try. Some persons, you know, do not respond, you know, on telephone. You see, I'm the admission and discharge plan. My work is to get people at home. So I'll visit. Sometimes I visit them.
So you have to go and knock on the door?
Call them and speak to them one-on-one.
You call them, you don't go and knock on the door?
If I cannot get them on the phone, I'll fight with them.
Wow. Oh my gosh.
It doesn't strike a war, we become friends. And people begin to understand.
So if it strikes a war, then it's just a war, you don't become friends.
No, it escalated to that point.
Yes.
What direction do you take then?
Well, then we leave it in the government hands.
Basically, we're calling the police.
I'm just talking about the police.
So we're going to stick a thumbnail on that. We're going to, this is the segment, the section of the show where we speak about what's happening in the hospital with Dr. Jensen Morton. He's from the desk of the Director of the Health Services at JNF. So he's going to have a quick word with you guys and let you guys know what's currently happening at JNF.
I'm Dr. Jensen Morton, the Director of Health Institutions, and I'm coming to you here today from the Hemodialysis Department of the Joseph N. France General Hospital. Now, I'm taking this opportunity to let the persons of St. Kitts and Nevis be fully aware of the kidney transplant project that the Joseph N. France General Hospital currently has available for the citizens of St. Kitts and Nevis. So first of all, what are the benefits of getting a kidney transplant? So for persons with chronic kidney disease, the other option for treatment is dialysis. There's hemodialysis as well as peritoneal dialysis, but the type of dialysis that we do in the center is hemodialysis. Hemodialysis requires a person to come to get treatment 3 times a week. Each treatment normally lasts quite a few hours as their blood is taken out of their body. It's passed through the dialysis machine, it's filtered and it's cleaned, and then it's passed back through into the body. This entire procedure, apart from being time consuming, it also can be quite taxing on the body. And a lot of times persons, when they get dialysis, they're weak from the procedure and they're not able to perform a day's work. And if they have to get a procedure done 3 times a week, it limits the amount of work that they could actually do. Now, a kidney transplant eliminates each of these issues. For one, it eliminates the need for dialysis, and that means that there's no more time that's being consumed in the actual process of dialysis. For two, it is, in the long run, it is more financially beneficial to all, both the consumer as well as the government, because it's a one-time fee. It might seem like a lot of money if you were to check it out online, but it's a one-time fee, and over time it actually ends up being something that is cost-effective. And part 3, multiple studies have proven that a kidney transplant ensures that persons have a better quality of life as well as a longer life than persons who are dependent on hemodialysis. I should also encourage the persons of St. Kitts and Nevis that even though we have this ultimate treatment available for persons that are afflicted, the most important thing is prevention. Please ensure that you prevent chronic kidney disease by maintaining a healthy weight, having a healthy diet, having an active lifestyle, refraining from smoking, and refraining from alcohol consumption. Also, ensure that you get checkups every year, twice a year depending on your age, to ensure that in the event that you're just getting the onset of diabetes or hypertension, which are the 2 ailments which are responsible for the bulk of the development of chronic kidney disease in St. Kitts and Nevis, that we can get the problem quickly treated and addressed before we can get the descent into those comorbidities. So, thank you.
I hope they have it, you know. I hope they have it.
How can I help you today?
Yes, I've been searching for this medication everywhere and no one seems to have it. Please tell me that you do.
You've come to the right place. We have just what you need. And even if we're out of stock of the item, as soon as it comes in, we will notify you.
Thank you.
Bestway Pharmacy, always taking care of all your pharmaceutical needs.
Join us on ZIZ TV for Youth Lounge with Skanival, a talk show on vital topics such as tourism, entrepreneurship, education, religion, sex education, and mental health, featuring experts from St. Kitts and Nevis and the Caribbean region. Tune in live on the first and third Wednesday of every month at 8:30 p.m. on ZIZ TV.
And welcome back, viewers. I have learned so much, even though I'm part of the healthcare system and I'm a healthcare worker. There were a few little details that I wasn't made privy to. I did not know of all of these challenges that we have when it comes to not just admissions, the discharges. Nurse White was just telling me a bit off camera of some of her challenges, and I think I would like her to elaborate so that we can kind of shed a light. This is a conversation that could probably take on a whole other episode on its own, but I want to open up that dialogue now in terms of our respect and empathy for our elders and being there for them when they need us. And I'll let you elaborate on that part.
Yes, as my sister said, it is very difficult as nurses to be actually working and seeing persons that are left behind. When you say left behind, in the sense of being neglected, they're neglected by their loved ones, and they become the hospital babies. Nowhere we nurture them, we counsel. Nurses have to counsel because some of them are so broken in the sense that their families do not return. And being the admission and discharge plan, that's my job that I do on a daily basis, where I go and counsel and comfort some of these persons and try seeking to get the families in order to take them home.
So I was told there are some seasons that you have probably more counseling to do than others. Like for instance, certain festival seasons tend to be persons, well, I want to go to carnival, or I want to go to music fest, so even though my loved one needs me right now, he or she is about to be discharged, I'll just let him stay in the hospital until music festival is over, and then afterwards I could come for him, type of thing.
Well, I have not heard that to my face, but I heard other nurses complain and said what someone said. Oh, they want to go somewhere, so that's the reason why they're bringing them to the emergency room and so forth. And sometimes these people do pass through the channel and reach to the ward still. You know, but
like that's such an abuse of the system, though, and very inconsiderate. We used to be a time when we used to really respect and treasure our elders.
Yes.
So I guess that's a thing of the past.
Well, that's not a thing of the past. It's just a matter of new lifestyles.
New lifestyles.
And it's something that we need to pay some attention to, because too often I believe that we are neglecting our seniors. Our senior citizens.
That's what I feel as though most people say they don't have any time. They always say they don't have the time, but we put things in place, and that's why I'm there, in order to, with a team as well, to help me to arrange things in order to get them home, to make it easier for them find as much the social services. You do not pay for government social services, and then I could tell them they could, you know, wrap with their private caretakers as well, and involve even their younger ones at home. You know, get the children involved at home to be more caring. It's not only for mother and father. You have a teenager, you have to teach them empathy, to be, you know, part of that, because if they don't know how to care for even their own grand in the house, they will not care for them.
Step in there. I was just going to say, it is not easy caring for someone, especially if they become totally dependent on you.
Yes, definitely.
It can be a strain.
So I think we need a separate HealthWise to speak about geriatric care, elderly care, and just general nurturing of our elders. We're going to have to wrap it up. Our time here was short but sweet and informative. I would like to take this moment to thank my colleagues, Mr. White and Mr. Wilkes, for stopping by, and for Nurse Gilma Richardson. She has been a gem since I started working with her alongside at the ICU. And I would just like to take this opportunity to thank all of the viewers and everyone in Radio Land listening. Thank you and good night.
Good night.